Welcome to a comprehensive journey into the world of fetal radiology in India. This video explores the Kochi Fetal Radiology Conclave Declaration, 2025, and its vision for transforming maternal and neonatal care. Fetal radiology using advanced ultrasound and MRI is at the forefront of early detection, diagnosis, and intervention for fetal and maternal health. Despite India's high perinatal morbidity and mortality, most teaching hospitals lack dedicated fetal radiology divisions. In this presentation, we'll uncover why establishing such divisions is crucial, how they can improve outcomes, and the roadmap for integrating them into teaching hospitals across the nation. Declaration is the result of collaboration among leading experts in radiology from across India. These professionals, representing major institutions and associations, have come together to advocate for a unified approach to fetal radiology. Their combined expertise forms the backbone of the movement to institutionalize fetal radiology divisions, ensuring that every pregnant woman in India has access to high-quality, standardized imaging and care. Their vision is not just about technology, but about building a sustainable system for better health outcomes. At the heart of the Kochi Fetal Radiology Conclave Declaration is a powerful vision. Every pregnant woman in India should have access to standardized, high-quality fetal radiology services at the district level. This means timely detection, referral, and management of fetal morbidities, aiming to reduce perinatal mortality and disability. Establishing dedicated divisions for fetal imaging and care in teaching hospitals is seen as a critical step toward achieving this goal, aligning with national and global health objectives. Fetal radiology is central to prenatal and postnatal care. It enables early detection, accurate diagnosis, and monitoring of both fetal and maternal well-being throughout pregnancy. Advanced imaging such as ultrasound and MRI supports preventive and interventional therapies, improving outcomes for mothers and babies. Despite its importance, many hospitals in India lack dedicated fetal radiology divisions, limiting the potential for early intervention and comprehensive care. India faces a significant burden of perinatal morbidity and mortality. Key maternal fetal conditions include perinatal mortality, preeclampsia, fetal growth restriction, low birth weight, preterm births, and congenital anomalies. Recent data show improvements, but challenges remain. For example, the perinatal mortality rate has dropped but is still high, and conditions like preeclampsia and fetal growth restriction continue to impact many pregnancies. Addressing these issues requires a systematic approach, with fetal radiology playing a pivotal role. Perinatal mortality in India, which includes stillbirths and early neonatal deaths, has declined over the years but remains a pressing concern. National surveys report a rate of about 32 per 1,000 pregnancies, with specialized programs like IRIA Samrakshan achieving even lower rates. Improvements in maternal and infant mortality rates are evident, yet the numbers highlight the need for continued focus on early detection and intervention, which fetal radiology divisions can provide. Eclampsia affects 5–10% of pregnancies in India, making it a leading cause of maternal and fetal complications. Early identification using fetal Doppler and timely intervention, such as low-dose aspirin, can significantly reduce its incidence. Programs like IRIA Samrakshan have demonstrated a drop in preterm preeclampsia rates, emphasizing the value of integrating advanced imaging and risk stratification into routine prenatal care. Fetal growth restriction is a common and serious concern in India, with prevalence rates higher than global averages. Advanced imaging, particularly Doppler ultrasound, helps detect subclinical placental insufficiency and stratify risk early in pregnancy. Timely interventions such as nutritional support and planned delivery can improve outcomes. The IRIA Samrakshan program has shown that integrating Doppler with routine ultrasound reduces the incidence of FGR and the need for intensive surveillance. Low birth weight remains a persistent issue, affecting about 17–18% of infants in India. While there has been some progress over the years, the rate has plateaued. Integrating fetal Doppler with routine ultrasound enables early identification of high-risk pregnancies and supports protocol-based management. This approach has led to increased birth weights and a reduction in preterm births in program areas, demonstrating the impact of structured fetal radiology services. India has the highest absolute number of preterm births globally, with about 3 million cases annually. Preterm birth complications are the leading cause of neonatal mortality. Fetal radiology plays a predictive and preventive role through cervical length assessment, Doppler studies, and fetal MRI. These tools help identify high-risk pregnancies, guide interventions, and plan for safe deliveries, ultimately reducing preterm-related deaths. Major congenital anomalies affect 1–2% of Indian births, with cardiovascular and neural tube defects being the most common. Routine ultrasound and advanced imaging are essential for early detection and management. However, coverage is incomplete, and many anomalies go undiagnosed until late in pregnancy. Fetal radiology divisions can improve screening rates, enable timely interventions, and support families through counseling and management. Fetal radiologist is a highly trained specialist in imaging the fetus, placenta, and maternal-fetal interface. Their responsibilities go beyond image interpretation. They detect and monitor abnormalities, assess risks, guide interventions, and provide multidisciplinary consultations. Fetal radiologists are essential for early identification of high-risk pregnancies and for shaping evidence-based clinical practice, research, and training in fetal care. Fetal radiologists perform and interpret a range of imaging studies, including targeted ultrasounds, Doppler studies, and fetal MRI. These tools are used throughout pregnancy to monitor fetal growth, detect anomalies, and assess maternal health. Imaging also supports preconception studies, localization of ectopic pregnancies, and perinatal autopsy, extending the scope of care beyond the fetus to maternal well-being. Fetal radiologists are central to diagnosing and managing pregnancy complications such as fetal growth restriction, preeclampsia, macrosomia, and congenital malformations. They use advanced imaging to assess the fetus, placenta, and maternal health, providing critical information for risk stratification and intervention. Their expertise ensures that complications are identified early and managed effectively. Key role of the fetal radiologist is to assess the risk for conditions like preterm preeclampsia, fetal growth restriction, and congenital abnormalities. By evaluating the severity and natural history of fetal conditions, they guide prognosis, help families make informed decisions, and recommend preventative therapies. This proactive approach is vital for improving survival and quality of life. Fetal radiologists provide imaging support for a variety of invasive prenatal procedures, including amniocentesis, chorionic villus sampling, and fetal interventions like laser therapy or intrauterine transfusion. Their expertise ensures these procedures are performed safely and effectively, improving outcomes for both mother and baby. Preoperative mapping before fetal surgery is another critical contribution. Fetal radiologists work closely with obstetricians, neonatologists, geneticists, and pediatric specialists to provide comprehensive perinatal care. They participate in multidisciplinary boards to develop care plans, ensuring that each patient benefits from a team-based approach. This collaboration is essential for managing complex cases and delivering high-quality care. A vital aspect of fetal radiology is providing imaging-based counseling for parents. Fetal radiologists explain findings, discuss uncertainties and prognosis, and recommend preventative therapies when appropriate. This support helps families understand their options and make informed decisions about pregnancy management and interventions. Fetal radiologists are at the forefront of research and education, developing new imaging protocols, biomarkers, and AI-based prediction tools. They contribute to local evidence generation, set standards of care, and train the next generation of specialists. Their work ensures that fetal radiology evolves with advances in technology and meets the unique needs of the Indian population. Fetal radiologists bring advanced expertise in complex imaging and multidisciplinary integration, bridging the gap between imaging science and clinical decision-making. Unlike general clinicians, they are diagnostic consultants, risk identifiers, and procedural guides, playing a central role in advanced perinatal care. Their unique skill set is essential for early detection and comprehensive management of fetal condition. Establishing dedicated fetal radiology divisions in teaching hospitals is not a luxury, but a necessity. Concentrating expertise enables standardized care, multidisciplinary decision-making, and expanded training capacity. Dedicated divisions improve diagnostic accuracy, patient counseling, and neonatal outcomes, aligning with national health priorities and supporting the Sustainable Development Goals. Fetal radiology divisions focus on early, precise, and actionable diagnosis. High-resolution imaging identifies structural anomalies and guides clinical decisions, from antenatal interventions to delivery planning. Concentrated expertise reduces surprises at delivery, enables appropriate referrals, and supports evidence-based decision-making, directly impacting neonatal morbidity and mortality. Teaching hospitals are the backbone of clinical education in India. Dedicated fetal radiology divisions establish formal training pathways, including fellowships and multidisciplinary case conferences. This structure creates a cadre of specialists who can propagate best practices, reduce variability, and elevate the quality of care across the country. India's unique epidemiology and resource constraints require locally tailored research and innovation. Teaching hospitals with fetal radiology divisions become hubs for generating data, developing context-appropriate protocols, and fostering innovation. This research informs national policy, improves cost-effectiveness, and enhances India's role in global perinatal science. Fetal medicine thrives on collaboration. Dedicated divisions formalize linkages between radiology, obstetrics, neonatology, genetics, and surgery. Regular multidisciplinary meetings and coordinated referral pathways ensure coherent, team-based care, reducing fragmentation and delays for pregnant women and their babies. Prenatal imaging carries ethical and regulatory responsibilities. Centralizing fetal imaging within specialized divisions improves oversight, documentation, and adherence to ethical guidelines. It ensures compliance with national laws and reduces the risk of misuse or misinterpretation, safeguarding both patients and practitioners. Investing in fetal radiology divisions may seem costly, but it yields significant economic and social benefits. Accurate prenatal diagnosis reduces unplanned NICU admissions, shortens hospital stays, and enables early interventions that lower lifelong disability costs. Preventing avoidable neonatal death and disability benefits families and communities, reducing long-term healthcare burdens. Establishing fetal radiology divisions does not require high-tech luxury everywhere. A scalable approach, starting with clinical governance, fellowships, standardized protocols, and teleradiology networks, allows hospitals to build capacity progressively. Tertiary centers can add fetal MRI and create referral pathways, ensuring continuous professional development for radiologists. India's strengths include large clinical volumes, existing radiology expertise, teaching hospital infrastructure, and a motivated workforce. Telemedicine networks and evolving ultrasound technology further support the scale-up of fetal radiology education and services. These strengths provide a solid foundation for building dedicated divisions and improving care nationwide. Challenges include the lack of standardized fellowship pathways, uneven faculty availability, limited access to fetal MRI, and inconsistent ultrasound training. Resource constraints in peripheral hospitals and the absence of formal assessment and credentialing further hinder uniform rollout. Addressing these weaknesses is essential for sustainable progress. Opportunities abound in policy alignment, teleeducation, public-private partnerships, research funding, and international collaborations. Technology and AI augmentation, as well as interdisciplinary training models, can further enhance detection rates and expand training reach, making fetal radiology education more accessible and effective. External risks include regulatory complexities, cultural sensitivities, resource diversion, brain drain, rapid technology obsolescence, and data privacy gaps. These threats can undermine program sustainability and must be managed through clear policies, retention strategies, and robust data governance. The short-term sensitization about the need for fetal radiology divisions is crucial. Defining minimum competency frameworks, integrating fetal MRI and genetics, starting telementoring pilots, and introducing standardized logbooks for trainees are key steps. These actions lay the groundwork for sustainable, high-quality fetal radiology education and services. Medium-term actions include developing accredited fellowship and diplomate courses, implementing train-the-trainer programs, establishing quality assurance processes, and integrating AI-based reporting software. These measures build faculty capacity, ensure quality, and enhance the efficiency of fetal radiology divisions. Long-term goals involve advocating for formal subspecialty recognition, establishing regional MRI hubs, and creating a national fetal morbidity and mortality registry. These initiatives support research, training, and policy development, ensuring that fetal radiology divisions remain at the forefront of maternal and neonatal care. Effective risk mitigation involves regulatory clarity, retention strategies, sustainable financing, and robust data protection. Building legal and ethical training into curricula, appointing compliance officers, and ensuring secure data governance are essential for maintaining trust and sustainability in fetal radiology divisions. Suggested KPIs for tracking the impact of fetal radiology education include the number of accredited fellowships, trainee competency milestones, detection rates of major fetal conditions, telementoring sessions, retention rates, and registry completeness. Monitoring these indicators ensures continuous improvement and accountability. Multiple stakeholders play vital roles in establishing and sustaining fetal radiology divisions. Medical colleges and hospitals host programs, radiology departments design curricula, regulators provide accreditation, state health departments fund infrastructure, and international partners offer technical assistance. Collaboration among these groups is key to success. Teaching hospitals are uniquely positioned to lead the transformation of prenatal diagnostic services. Establishing fetal radiology divisions aligns with their mandates to provide patient care, education, and evidence generation. By prioritizing fetal radiology, hospitals can improve outcomes, train specialists, and produce data that guides national policy. The process begins with sensitization and acceptance among radiology faculty. Providing high-quality services, enhancing research, and promoting community participation are essential. Key initiatives include encouraging fetal MRI, genetic screening, and establishing fellowship seats to strengthen expertise and services. Fetal radiology divisions should offer advanced diagnostic capabilities like fetal MRI, genetic screening, and interventions. Establishing fellowship and diplomate courses strengthens staff expertise. Leadership in fetal radiology services, multidisciplinary collaboration, and comprehensive screening are vital for success. Integrating AI-based reporting software and ensuring adequate support staff are crucial for efficient documentation and smooth processes. Technology enhances reporting accuracy and streamlines workflows, allowing radiologists to focus on patient care and research. Failing to establish fetal radiology divisions has real consequences: missed or misdiagnosed fetal conditions, poorly planned deliveries, avoidable neonatal suffering, and long-term health impacts. The cost of inaction affects families, communities, and the nation's health system, making the case for urgent action. To honor commitments to maternal and newborn health, teaching hospitals in India must prioritize and institutionalize fetal radiology as an essential division. This integrated approach is not an add-on, but a necessity for improving outcomes, training specialists, and generating evidence for policy and practice. Fetal radiology education in India stands at a strategic inflection point. With clinical volume, infrastructure, and motivated personnel, the country is poised for progress. By implementing standardized competencies, leveraging telementoring, and building regional hubs, stakeholders can create a sustainable, high-quality ecosystem. This will not only improve diagnostic accuracy and perinatal outcomes but also close inequities in prenatal care, setting new standards for maternal and child health in India.